At this moment we have in the US and in Europe 2 monoclonal antibodies approved, Elotuzumab and Daratumumab. Elotuzumab is approved in combination with lenalidomide, while Daratumumab is approved as monotherapy, but also in combination with lenalidomide, bortezomib, and in the US also in combination with pomalidomide, dexamethasone. And all these approvals are in patients with relapsed disease. And I think, for example, the Dara-RD combination and the Dara-VD combination are very powerful treatments that we can use for relapsed refractory patients with at least one prior line of therapy. And also Elo-Lendex is a very good regimen which also can be used for patients with at least one prior line of therapy. Elo-RD, Dara-RD, K-RD, Ixa-RD, so the Lendex containing regimens are very effective, of course, after a prior line that contains bortezomib, while Dara-VD and KD are regimens that can be given after a lenalidomide containing regimen. So we are using now antibodies increasingly in the setting of relapsed refractory disease, and I think we will soon also be going to use these antibodies in the upfront setting. We have already data from the Dara-VMP combination, so Dara added to one of the standards of care in myeloma for elderly patients, VMP. And Dr. Mateos showed at ASH last year and also in the New England Journal recently that Dara-VMP results in a better response rate, better progression-free survival as compared to the standard of care VMP alone. So I think now we have as standards of care VMP, RD. In the future for elderly patients we will have Dara-VMP, hopefully also Elo-RD or Dara-RD, but probably also non-antibody containing regimens like KRD, VRD, Ixa-RD approved, so that our treatment arsenal are the regimens that we can pick and choose based on patient characteristics, tumor characteristics, will enlarge. And also for transplant eligible patients, I think soon we will have strong data which will give us access to antibodies for these newly diagnosed transplant eligible patients. And then together with induction, together with consolidation, probably in maintenance, and this will result in higher response rates, higher rates of MRD negativity, and better outcome.